But we do what we can, but everyone in my family, heck, I'm 56 and I'm still kicking butt, and I'm going to be kicking butt at over 100, just like you do. But the reality of it is, just look, I look at my life, and I see some of my greatest friends. I see the guy that helped take down the AMA and the antitrust suit. I see my roommate in chiropractic college dying, yet they're under the best of chiropractic care. And they're dead, and guess what? They're not even hitting the statistical average for their gender, and they're dead. And it's because they thought that that they could drink gasoline, and if they got adjusted, they would be okay. I disagree with that. You cannot ever drink gasoline, ever. I don't care how many adjustments you get, you're in trouble. So I'm going to give you some bottom line stuff when I come up to it. I'm always kind of an eye to the clock. When you kind of look at these words here, look at these words where it says, the day of reckoning is, it says, a multi-trillion-dollar problem that is about to get dramatically worse. Why is it about to get dramatically worse if this was written in 2008? Because the baby boomers started to retire in 2011, last year. Oh my gosh, they're going to have to come up with some major, you look at this, it says, the day of reckoning is imminent. It says Medicare will go cash flow negative, and it's all downhill from there. Medicare and Medicaid will devour growing chunks of the U.S. economic output. It says if Medicare had to be accounted for like company pension funds, it would be underfunded by $34 trillion. That's as of 08. Currently, guys, it's 38 trillion. If you look at the literature, Medicare whole is going up $1.5 trillion a year. You're thinking, and it's all, take a look what it is. It's all disease treatment rather than prevention. It is exactly the opposite of our message. Yeah, I get a guy in for whiplash or for this or that, or he's got a diagnosis and I treat him. But for 100% of our patients, when they go to patient education class, our message is that we have to take care of ourselves and that we have to get under maintenance care. We pitch everybody on lifelong maintenance care because that's where it is. And we finally have this study, Cifuentes, came out last year. And there's other studies that allude to it. Look at the Giles study. Did you guys see the Giles study on chronic neck and back pain? I mean, to me, this is the IC's best study coming out in Spine, our #1 orthopedic journal in the world, Spine. The official journal publication, the world's top 14 spine society. They did a study on chronic neck and back pain, and they compared the drug Celebrex and Vioxx to needle acupuncture to chiropractic. We kicked their butts. Not only did we kick their butt in the short run, which was 9 weeks, we kicked their butt in the long run, the 1-year follow-up. But what I thought was so incredible about that study, if you read the Giles study, not only did we kick butt on back pain, but we also had an incredible, better than anything else, even better than our outcomes on back pain, was improvements in systemic health and well-being. That's chiropractic. Improvements in systemic health and well-being. That's the message. When I hang out with the ICA guys, the president is right here. You guys know Gary? And he needs your membership. If you're not, he needs it. Sign up. As I'm working for ICA in Minneapolis, I could be in Minneapolis today. I'm doing CCSD, the Certified Chiropractic Spine Trauma Certification Program. The ICA's message when I listen to them is, do not let our profession get pigeonholed into only treating sore necks and sore backs. We're good at that, but if that's all we do, that's stupid. Chiropractic improves systemic health and well-being. If you are a fan of the literature, if you ever take the neuro class that I do, I've done it even as late as last year right here in New Jersey, if you ever do that class, one of the things I keep pointing out, chiropractic doesn't exist because a deaf guy got his hearing back. That's stupid too. Even if it's a true story, none of us are going to make a living treating deaf guys. Chiropractic exists because of something far grounder, and it's the 1918 flu. That's why we exist. You take away the flu, there are none of us in this room today. Chiropractic survived because public health officials realized that the sickest of the sick that got into chiropractic or osteopathic management had significant increased probabilities of surviving. That's why we got licensure. It was because of an infection. Chiropractors' mainstay was infection all the way up until the 50s when they started to use antibiotics and vaccinations, and then we started to do sore necks and sore backs. But the reality of it is, chiropractic changes systemic health and well-being, and I've spent my entire career collecting the literature on how chiropractic and the way we live, exist, and function in gravity influences the efficiency of our immune system. And so you kind of put all these things together and you're thinking, whoa, this is why, even if you saw the Breda study when it came out some decades back, they looked at chiropractic families and they looked at pediatrician families, and they found that the rate of otitis media in the chiropractic families was pretty close to 0, while the rate in the allopathic families was smoking high. Yet they're the same kids in the same community. How come one group has got all kinds of ear infections per year and the other group almost has none? It's because their immune system works differently. That's because they've proven. If I'm the mechanical guy that registers the way I live, exist, and function in gravity, and you're the guy, you're the nerve that controls the immune system, by the way, it's called postganglionic sympathetic afferent. Do you guys know, shake my hand, they shake hands in the cord. And every time that this guy is doing stuff, he's telling this guy how to run that part of the show. The result is even, I just posted another article, my article review service coming out of the Journal of the American Osteopathic Association, flat out saying infections is directly linked to secretory immunoglobulin A cells. And then when they adjusted the control, when they adjusted one group and not the other group, the quantity of immunoglobulin A's just jacked way up, and they documented it. Just got it published last year, 2011. I mean, it's this stuff that I think is really the coolest stuff in chiropractic. It's a completely different model. How often have you had people say once they got out of your care, you know, I used to get pneumonia every year, but since I've been in here, I've never had it? How often do you hear stuff like that? How often do you hear just the other thing where you've got a staff person that says, well, I have a cold today, I don't think I can come into work. That's bogus. You get that thing by Walter Rhodes. Heck, I typed it up. I think it's on my webpage, and it's under free stuff. It's a button. His friend says, when you have a cold, that's the day you need to get in, because what we do, when I was, some of you guys remember, I had the hardest day last year. I had to eulogize Don Harrison. Oh my gosh, that was the toughest day of my life. But back in 1982, when I was a young chiropractor, I came down, I decided that sleep was boring, and I decided not to sleep anymore. And I came down with viral meningitis, and I almost died. I was on the brink of death. I was on death's door. And I think I would have died if it wasn't for Don Harrison. So Don put me in the back of his clinic, and I would just sit there, just about ready to die, and he'd just pop in, and he'd work on my dorsals and do something to me. It's like, whoa, it just like sparked me back alive. And then I would get back again a couple hours later, thought I was going to cash in, and he'd just pop in and work on me again, and he worked on me kind of like nonstop for that week, and I'm telling you, he pulled me out. It's weird, I tell that story every now and again. Someone comes up to me and tells me similar stories. You know, I'm energized, I was going to croak the chiropractor, somebody to say it. I mean, if you ever look at the studies, read Walter Rhodes. It's called The History of Chiropractic in the State of Texas. Read Rhodes. I found it on the internet. I gave a copy to my friend, Dr. Jerry Plum at Life West. You read this stuff and you start to understand that, yeah, we are good. You go one block, this is the sad